Good morning. We're ready to start. So my name is Paula Soares. I'm going to explain a little bit more about who I am and what I do in a little bit. But first, I wanted to get to know you so I have a better sense of who we're working with. And I know that they already had the whole game outside, so we don't need to do this again. I was going to do it again, but we don't need to do it again. But I have a couple questions for you. First, I wanted to know who in here is a human. Raise your hand if you're a human. Okay, you're identified. Okay. Raise your hand. Who in here breathes? Okay, good, everybody. I want to know who in here has emotions. Everybody, right? I want to know who in here sometimes gets sad. Yeah, I do too. And excited. Good. Who in here gets angry sometimes? Good. Who in here feels like you know what to do with those emotions? Sometimes, right? That's what happens, right? We all are humans. We all breathe. We all have emotions. And most of the time, we don't know how to handle our emotions, right? And most of the time, we're also not using the technology we have as humans to handle the emotions, right? So I'm going to speak a little bit about this project, but first of all, I wanted to show you the product of the project, and then we're going to talk about it, okay? So first of all, I'm going to show a video that we have done as part of this project, and then I'll explain how we got there, how it works, how we're going to use it, okay?
Soluciones para cuidar de nuestras emociones. Una vez que una emoción ha empezado, nadie le puede parar. Podemos reprimir las emociones, pero no desaparecerlas. Así como una olla presto que explota, las emociones cuando están reprimidas ganan intensidad y pueden afectar nuestra salud física y mental. Lo que uno resiste, persiste. Por eso es importante aprender a manejar nuestras emociones. Pero, ¿cómo lograr calmarnos? Aquí están 4 pasos prácticos para calmar nuestras emociones. 1. Cierre la boca y respire por la nariz. Cuando cerramos la boca en la nariz, se activa 6 veces más una molécula esencial llamada óxido nítrico. El óxido nítrico nos ayuda a tener mejor circulación y lleva 20% más oxígeno a las células. Cuando respiramos con la boca, no se activa esta molécula. Tener más oxígeno no solo nos mantiene más relajados, en general, nuestra salud mejora. Así que mantenga la boca cerrada cuando respira. Para calmarnos, la exhalación debe ser más larga que la inhalación. Por ejemplo, cuando inhale, en su mente cuente al 4 y cuando exhale, cuente al 6. Y puede contar números más altos a medida que se acostumbre con el ejercicio. Eso es porque cuando inhalemos, el corazón late más rápido y el sistema nervioso se activa. Por la exhalación lenta, larga, ayudamos a que el corazón late despacito y la presión se estabilice. De esta manera, se manda la señal de relajación al cerebro. 2. Si lo puede nombrar, lo puede curar. Una vez que está más calmado, dése cuenta de qué emociones están sintiendo y nombre la emoción. Estoy triste, enojado, frustrado o ansioso. No se identifique con sus emociones. En su mente, en lugar de decir estoy ansioso, ansiosa, piense esto es un síntoma de ansiedad. 3. Sienta la emoción, no sea la emoción. La intensidad de una emoción empieza a disminuir cuando lo sentimos en el cuerpo. Quizás pueda notar que la presión en tu pecho está relacionada con la ansiedad que siente. Respire y relaje los músculos en lugar que siente la emoción. 4. Valide y acepte tus emociones. Por ejemplo, piense, es un momento difícil. Los retos son parte de la vida, pero voy a estar bien. Con estos pasos podrá estar más tranquilo o tranquila para relacionarse con las personas que los rodean. y pensar con más claridad para encontrar las soluciones de sus problemas.
La campaña Escucha Tus Emociones, Cuida tu Vida es una iniciativa de esperanza, un proyecto del Centro Hispano del Condado de Dane. Esta campaña es posible gracias al apoyo de nuestros patrocinadores.
Okay. Thank you for watching. So I want to share, I want to do a quick exercise with you, and then we're going to go to this. I want to explain what we do and why we do it. So first of all, I wanted to ask to get up, if you can. And I want to ask you to put your feet on the ground, both, very connected to the ground. I invite you to close your eyes if you feel comfortable. And if you don't feel comfortable, you can just glaze on a spot in front of you. And I would like for you to pay attention in your body. Don't change it, just notice. Just pay attention in your body. How are you feeling right now? If there's any emotions coming through or not. If you feel comfortable or not in this room. And also notice, how's your breathing? Notice if it's more shallow up in the chest or if it's down in your belly. Just notice, no change, no judgment. Now I want to do the quick exercise that we learned and just to see if you feel the difference, okay? So what I would like for you to do is to breathe in. Count to 4, and you exhale, count to 6, okay? So let's do it together. Breathe it in. 1, 2, 3, 4. Exhale, 6. 1, 2, 3, 4, 5, 6. Let's do one more time. Breathe it in. 1, 2, 3, 4. Exhale, 6. 1, 2, 3, 4, 5, 6. Now just pay attention if that changed a little bit. If you're able of doing it or not. And then in your own time, I invite you to come back to the room, open your eyes, and then just take one more deep breath. And you can sit down. So, question for you. How many of you feel like you breathe during the day? Deep like that? None of us, right? None of us. And it's such a huge technology we have, right? So this is a snap out of anxiety. This is a snap out of a lot of things, but we don't know how to do that, right? So this is just an example I want to share with you what we do in the community, what our leaders are doing in the community. So I'm going to explain about the project first. And I wanted to invite somebody to share a little bit to introduce the project. I want to call Carrie to introduce the project to us.
Buenos dias. Good morning. It's nice to see everyone here. So my name is Carrie Southern. I work for Community Advocates in our Public Policy Institute. In our Public Policy Institute, we have a long history of doing substance abuse prevention work. But over the last few years, we really started to recognize paying attention just to the substance abuse prevention side of things wasn't effective unless we also considered mental health and wellness of folks. So we started doing a lot more training in the community, and we used a curriculum called Mental Health First Aid. Great curriculum. We do a lot of training with professionals. If you're on our listservs, you might see those advertisements from time to time. But what we really recognized is that wasn't a a solution for all of the community that was really geared for a certain population. And as we started to look at the work we did, particularly on the South Side, we were recognizing that was not a culturally competent, a culturally relevant answer as well. So I was able to connect with the fabulous Paula, and we started to talk about how could we make a training series around mental health and wellness that was culturally relevant to the Latinx community. So we did a lot of work. And by we, I really mean Anna Paula. And she had a great group of folks that she was able to connect with. And for the first time, it really felt like we were able to be really thoughtful and work on a product that really could reach the community in a different kind of way, meet them where they were at. So I'm really thankful for all of you. I know many of you are involved in that work, and I, to the depths of my soul, I so appreciate your participation and your efforts with this. And I look forward to having Anna Paula share more of what was developed. Thank you.
Thank you so much. And without their support, of course, we could do a lot of amazing work, but we not have the resources that we have now to do all this work. So I just want to share a little bit about what it is. So this is a community-based mental health intervention. So some people might say, oh, this is a cute community project. Well, it's way bigger than that, right? It's a real big intervention, and it's a community-based mental health intervention. It's developed by and for the Spanish-speaking Latinx community. We're honoring 3 different things. One, we want to go beyond culturally competency. So what I see in public health is that sometimes it's an afterthought. A lot of people do beautiful work and they go like, oh, let's translate that to Spanish. Or like, oh, this is great. And then let's invite a couple folks that can implement this in the Latino community, right? But it doesn't really have the aspect of community development, or sometimes doesn't have the aspect of the depth of community knowledge, right? I also see people going like, okay, so we don't have enough mental health professionals. Let's train folks in cultural competency. Well, we're recognizing that's not enough, and I will talk more about this. So we believe and lie on the strength, resilience, and wisdom of our community. We also want to move beyond Western approaches to mental health. Nothing wrong about that. It works, yes. Does it work for everyone? No. Doesn't help with all the complexities of the things our communities are experiencing? Not always, right? So we want to embrace our multicultural roots. A lot of us have indigenous backgrounds. A lot of us have multicultural roots that we understand wellness in a different way. We see things in a different way, and our families already have ways to cope with mental health and physical health issues that we are not being allowed, or we're not remembering how to do it anymore. So we want to embrace our multicultural roots. We want to reclaim our sense of wellness. We want to provide approaches to mental and emotional health that takes into account the complexities of our communities. Intergenerational and historical trauma, immigration is a huge thing for our community, and discrimination, acculturation, right? So somebody comes with anxiety, with depression, or substance misuse. And if you don't take as account out of this, you're really not providing the service that we think is comprehensive to the community. The third one is we need to be very creative to increase access, right? Even though we're 19% of the population in Milwaukee, 30% of our Latinx community is uninsured. 30%. And from the 30%, even the ones that are insured, they have a really hard time finding bilingual mental health professionals, and or are very overwhelmed with the healthcare system. They have to wait for months to get into places, right? So we need to be really creative in creating access. We can't just be waiting for the system to figure this out, because it's very complex. So we developed 4 different strategies, 4 different components in this. So we created a multimedia campaign. And with this multimedia campaign, we have 4 components. Resource development by and for the community. So once again, we don't want to translate materials. It needs to look like us and smell like us and sound like us, right? It helps. There's a lot of studies showing that if you identified with it, you're more likely to do something, right? And also we're sending a message out there. They're like, okay, you have to be somebody else to be healthy, right? So we have done development and promotion of culturally and linguistically appropriate videos, digital psychoeducational materials, which is one of the ones you saw today. And then we have done TV shows, billboards. I'll show it later. That was prior to this funding, right? That was prior to this. We already have done this. I'll explain more. Then our second strategy is community capacity building by training and supporting leaders in the community. And that's what we're very thankful to community advocates that are helping us to train community leaders. The third strategy is to then support those trained leaders to be able to have resources enough to go in the heart of the community, right? People are not necessarily reaching the system for several reasons. Some people are undocumented, some people are uninsured, some people are able to but don't find, right? So if they're not reaching the system is not reaching them, we gotta go where people are. Done. Right? Our community is in mental health crisis. We need to know where they're at, and we need to go where they're at, right? So we're doing those talks in the community. It's called Mental Health Community Talks, or Pláticas. And in homes, churches, community organizations, schools, right? And the last one is that we have done in the past, and now we're going to do it this year again. We're going to host some healing sessions in the community. So some of the folks who are going to those leaders groups can actually have a healing session with a licensed professional that's going to start soon. So those are we started this campaign with funding from the Wisconsin Department of Health Services in 2020. And we decided that we needed more money. So we're like, we need to match this. And then we started a campaign, and we were able to fundraise $100,000 in 4 months. So we got partnerships, and then we got other funders that donated money so we could finish the videos and we can do other things. So I want to talk very briefly about this. This is the campaign team. So we have worked with Sandra Dempsey from Source 10. She's a producer and a leader in the community. It's very well established. And then Maria Salcido, a licensed professional counselor that helped to develop all of this, the scripts for the psychoeducational. And then I did the clinical direction and the coordination of this. And we have our fantástica Ángeles Soares, promotora de salud, community health promoter, and leader for many years in the community, who helped to also develop scripts, and now it's mentoring other leaders. So we did 4 videos, and the 4 videos, this one you saw with practical tips to how to calm your emotions, how to control negative thinking. Huge thing in our modern society, right? A lot of people come to me as a therapist and say, how do I stop my mind of having negative thoughts or having just thoughts? I just want to breathe, right? So that's what we're trying to do. Also, we had a video about healthy communication in the families, and a video about how to have a better relationship with their children, especially teenagers. We did TV shows, and we did live shows in social media. And then we did some interviews on the TV, PBS and Telemundo. We also did billboards, and we have a website, and we did printing cards to doctors to give it to their people in the community, right? So that was a lot of work, but it was a lot of fun. So it took us like a year and a half to do all of this. And then those are the organizations I want to share that have promoted this material prior to this grand cycle. So now is today where we're at. With all of this, we're like, okay, we have all this material. We have, amazing, culturally competent, done locally. We need to promote this. We need to go to the community, right? So that's when we started partnering with community advocates, and we got funding from Better Ways to Cope to be able to then multiply this to the heart of the community. And that's when we started developing the mental health. We looked around for curriculum, and then I didn't think that we had comprehensive enough of a curriculum to our community. So a lot of the curriculums are good, but once again, they're not necessarily talking about immigration, acculturation, historical trauma. They're not talking about the layers of complexities that our communities are facing. So we decided to do our own. Which was fun, and I say thank you for the patience of our leaders, because we were like, bringing a lot of information and a lot of things for them at once. So we did a training that was around 20 hours, 16 hours of classroom training, and then 4 hours of practicum where they went in the community to do the groups and then prepare for the groups. And then we met after all to see how it went. So we had 49 leaders trained, and we had written in the grant 20. So we also had, I'll talk about this later. So we had wrote for 20 leaders, and we had actually like almost 50 leaders that were trained. We had 99.99 retention. Only 2 people couldn't finish because of personal reasons, but everybody else did the whole training. It was really fun. And then we are providing mentorship. And then we did a thrill evaluation. The leaders had to be so nice and fill out a bunch of links and forms. So we had good evaluation. But we have a very thorough evaluation for the training for future. And so here you can see this is our practice. Before we did the group, this is the practice where they did like group facilitation training and try to have a little bit of experience doing group facilitations. And this is the training focus. We did introduction to mental health and emotional intelligence, physiology of stress and trauma, the effects of immigration on mental health, intergenerational historical trauma. We talk about traditional healing and indigenous ways of healing. We talk also about natural healing with Chinese medicine and mental health, a lot of practical tools for emotional stress reduction. We had a full day of a retreat that we call. And then we talked about healthy communications, adolescents and mental health. This aspect was very interesting because it was not in the curriculum. But because of the need of our young ones in the community, we added to the curriculum. And it was really important to do that. We also did group facilitation and also how to work with the campaign materials that we have developed. And then, wait, what happened? Yeah, there you go. So we decided that, okay, we had the videos, great. And then what can we do to support people to bring that information home? So from the videos, we developed 4 brochures. Each video has its own brochure. With all the tips that we have in the videos are in this brochure. And then we developed also exercise sheets that the leaders can take in the community. So the idea is that they go in the community because they're trusted. They know where people are. They show the video if they can. Then they have the brochures to look at it and go, okay, let's talk about those tips. And then do the exercise sheets and open up for discussions and things like that. So they have a structure so can help the leaders to do what they need to do, but they also have flexibility to do what they need to do. And this is the amazing work that they have done only in the practicum. So this is only part of the training. Only part of the training, we have reached 220 people already. We had wrote down in the grant 9 groups. They actually did 28. Because we multiplied the number of leaders, we multiplied the number of groups. And I used to call, Gary, we need more printing. We have more leaders, more groups. People are showing up. We need a midnight delivery from Prime, more folders. So we keep multiplying, which that speaks to one, the amazing hard work of the leaders, the need of the community, right? And the open heart and resources from community advocates. So we had, 220 people. We were expecting like 100 people we wrote in the grant, and now we have like double that number. Here's more groups in the community. The groups are in people's homes, like I said, over there is somebody's home. Here's in the school setting. Over there is in the school setting too. They had some on churches. Here, for example, this is like a gym in a school. Oopsies. There's over there is a 16th Street Clinic, Coral Central. And then I want to speak to a model that we're using that one of the models that we use is a model of mentorship. So I wanted to introduce you to the Fantástica Mentoras and Patty and Angeles. And the idea is that what I learned over the years doing training and leadership in the community is that you can train somebody and then say, good luck. Most of the time what happens is that they end up not continue doing the work for many reasons, right? A lot of the community leaders are in the heart of the community, so they have the same issues. They have to work other jobs. They have to pay the bills. They have to figure out other things. They have their kids to, life happens, right? So in order to retain people engaged in what they love to do is really important mentorship. Like, what's going on? Like, I come to, reminders of the meetings and, and creating a sense of community. So it's very important to create a sense of community. We can't just train people and let them, good luck. It doesn't work. Most of the time, we have like 15% retainment and people just end up doing other things. So the mentorship model is very important, and I'm glad that community advocates agree with that and also created support for that. So this is some of our amazing leaders that were trained, and isn't it amazing? So I wanted to share, I need to check how much time we still have, but what I would like to do is to invite our mentors to speak from their heart, just to share what their experience has been in seeing their leaders growing. So you can share who you are and say a little bit about your role, and then what you see the leaders growing. And then I also wanted to invite any of the leaders that are here that if feels called to share what has been your experience in the community. Like, what are you seeing the gains in the community on all this? Is okay like that? Yeah? So I wanted to invite whoever's feeling called first. Patti already has 1 feet. So welcome.
Hello, my name is Patricia Luevano Mayorga. You can call me Patty. I work for the 16th Street Clinic, the community advocacy. I am the community advocacy coordinator for the community wellness department. And my main work in that department is develop community leaders around the Southside community. That is been very impactful, and which we want. The mission is to create and maintain a healthy community. And it's been since 10 years ago. We do nutrition classes at parks, churches, whatever, around. So I always describe myself like I am the wings of the butterfly that goes and reach the community. Either they are patients or not for 16th Street. They are just human beings that are in need, and we are there to help them. We do physical activity training around the community, increasing the physical activity just to keep our community's health. But we didn't thought about mental health, which this program came perfect to fit this mission, to reach the goal that we want to, the mission. So when Ana Paula invited me, I had already 40 community leaders taking that had taken the training. The group is called Líderes por la Salud. And they were amazed about this beautiful program. I also started training because every year I train a group of people. Every year I have a new cohort. So I invited even the new cohort for the 2023. So they are being very impactful for this program. I have to say, we have been doing these nutrition classes around the parks, but I think the mental health facilitation is being so impactful to them, even taking the training, because it's a way to heal first the immigration trauma, topics that we don't talk in the community. We know that we are hurt, we are traumatized for leaving our countries, but we don't even know what is that pain in your chest. So now, finally, listening Ana Paula, the wording that she used is, oh, I have that. And I'm healing that. And I think that is the power of this beautiful program. Whenever Ana Paula, I describe, she mentioned something like awaken your heart. And I was like, despertando el corazón. And for me, I was like, oh my God, that is beautiful. And then she explained it to me because I was not part of the first campaign. She explained it to me what it means. And it's really, the really meaningful message that we are doing. We are impacting the community by awakening our heart, our ears, you know. So I think that is beautiful. Escucha Tus Emociones is a beautiful program. It's an impactful program. We are here. The community leaders, I hope they will be here to share their testimonials. They have many, plenty, and I hope they can come and share some of my Líderes por la Salud, or even though if they are not Líderes por la Salud, they are part of the group Escucha Tus Emociones.
Thank you. Thank you, thank you, thank you. Ángeles, do you feel called to... ¿Y cómo quiere hacerlo en... Sí.
En español yo.
Sí.
Y tú traduces.
Sí.
Okay. Hola a todos. Mi nombre es Ángeles Soria
Hello, everybody. My name is Ángeles Soria.
y soy promotora por varios años
I'm a health promoter for many, many years.
en,
many years.
en diferentes
In many
organizaciones.
different organizations.
Actualmente estoy trabajando en Mujeres con Poder, soy parte de la coordinación
Most recently, I'm one of the coordinators for the Mujeres con Poder
y Plan Parenthood,
and Planned Parenthood.
también por varios años.
Also for many, many years.
Bueno, ahora estoy muy emocionada de pertenecer en esta campaña
I'm very emotional to be part of this campaign
y formar parte del proyecto.
and be part of the project.
Y es algo muy grato poder hacer esta labor en la comunidad.
I'm very thankful to be able to do this work in the community.
La razón es que no hay muchos recursos que puedan ayudar a la gente a tener acceso a un cuidado de salud emocional y mental.
The reason is that there's not much access to the community to have mental and emotional health support.
Y ahora con esta campaña de Escucha Tus Emociones,
And now with this campaign, with the Escucha Tus Emociones, listen to your emotions,
ha sido muy beneficioso poder invitar a otras organizaciones, a otros promotores de salud,
it was very beneficial to invite other organizations, other leaders, and health promoters
para realizar esta motivación
to do this motivation
a que tengan cuidado en su salud emocional.
to take care of your emotional health.
Y Escucha Tus Emociones es un programa muy sencillo, claro,
And there's a program that's very simple and very clear,
y que la gente puede tener de una manera fácil acceso a escuchar todos los tips que damos
and the community has easy access to a lot of tools
y platicar en una forma natural
and talk in a natural way
con la gente.
with your own people.
Ellos expresan sus emociones,
They
platican
really express their emotions and they actually talk.
y se toma como al estar hablando de los videos, ver lo que pasa en los videos.
And we can talk about what we see in the videos.
Esto ayuda a que la gente se comience a abrir,
It helps to open up people.
abrir de todos sus problemas que tienen interiores, que sienten pena hablarlo con otra gente.
And they normally would not. They will feel like ashamed to share with other people.
Entonces, con el programa y estando en confianza
And with this program, because there's like trust
en tu casa,
in
en la
your
escuela,
home, in
con-
your schools,
con otras personas que nunca has hablado, se ven todos los días, pero en ese momento haces una cercanía.
it's people that you might know before, but with this makes it more close, brings people close.
Entonces, este programa de Escucha Tus Emociones es muy bueno
So this program is really good,
y también me siento muy orgullosa de mis compañeras
and I'm very proud of my colleagues
que han podido llevar algo nuevo a nuestra comunidad,
and could bring new things to our community.
algo que no se había llevado en la salud mental.
The first time that never had done this with mental health.
Entonces, esto podemos ayudar a que la gente despierte y reconozca si yo me siento triste, ¿por qué me aíslo? ¿Por qué no socializo?
So it helps people to recognize if they're sad, why they're isolating themselves, why they're not reconnecting with other people.
Esto me ayuda a buscar ayuda
And
profesional.
that helps me then to look for support.
Y es lo más importante que debemos de hacer, en llevar este mensaje, en reconocer qué necesitamos cada uno y que las personas que estén a cargo de la ayuda de salud mental hagan más recursos en relación a este tema tan importante.
And then entonces,
Oh, sorry.
And then the people can actually feel like they can look for supports, and then the people can create more resources that's needed.
Eso necesitamos, y pues gracias a todas mis compañeras nuevamente por ser la primera vez que han llegado a los hogares, a las escuelas,
Oh, sorry.
a llevar este mensaje.
Otra vez.
Me siento muy orgullosa de mis compañeras
I feel very proud of my colleagues
por haber llevado este programa hasta las casas,
to bring this to people's homes,
escuelas
schools,
y el lugar donde se les hizo.
and wherever they are.
Yeah.
Wherever they are.
Y otra de las cosas que tal vez no nos hemos dado cuenta del programa, el impacto que estamos causando, es porque hablamos de diferentes temas que son para adultos
So
y para
one of
jóvenes.
the things that are very good is that we're talking about different themes and different ages,
Es una excelente guía.
and it's very good guide.
Gracias.
Thank you.
Y no hablo inglés suficiente y hablo poquito, no me siento muy cómoda en hablarlo. Entonces, no me siento muy cómoda en la traducción, no de ella, sino que yo quisiera hablar más.
I would like to speak more, but thank you.
Gracias nuevamente.
Gracias, Ángeles.
Thank you so much, Angeles. They work hard and they're amazing. So we have time for we have 2 minutes. I want to see if one of the leaders would like to share a minute of a word of your experience.
Thank you.
Hi, everyone. My name is Cecilia Tenorio. I was fortunate to be a part of the training. And as an individual who I myself am from the Milwaukee South Side, born and raised, but I'm also an individual who struggles with anxiety, depression, and PTSD. So taking this type of training has not only been empowering for myself, but each time I'm able to give a training to my community in our native Spanish, you can see the ripple effects of this program and this training. So it's a much bigger than, the leaders and the planting of seeds that I've seen just in the 2 platicas that I hosted. People were thirsty for more. They were super grateful, and they just gave me nothing but good feedback. And sometimes I do feel a little bit of imposter syndrome, right? Like, who am I to talk about this stuff? I myself don't have it figured out, but that's kind of the big secret. Like, there's nothing to figure out. Each time you share these resources and we have these vulnerable conversations, we heal ourselves and our community at large. Thank you.
Secret is out. Thank you, Cecilia. Thank you so much. So we have 30 seconds. I want to finish inviting the leaders all to come here in front. Please, Ruth. Everybody, come. Patty, come. And just I wanted to introduce, come. Angeles, just wanted to show. So this is a little portion of our family. I just wanted you to meet. And thank you so much. Thank you so much for listening. And thank you for the support. And then we have a lot more work to do in 2023. Thank you so much. Thank you. Gracias. Thank you.